The Omicron variant has driven Colorado's positivity rate in new cases to pandemic records. So many Coloradans are recovering from an Omicron infection right now.
And we're starting to learn more about what that might look like right now. 9Health expert Dr. Payal Kohli is joining us now with some insight into recovery and reinfection. Payal, everyone knows someone that is there within the last couple of weeks alone. So what does it look like, this type of COVID, this Omicron? Does it cause that long COVID so many people have talked about?
So true, Kim. We're seeing all of our friends and family members recover. And what we're seeing is that most people within 5 days, some 10 to 14 days, are pretty much back to normal. But there is a subset of people that continue to have fatigue. And essentially what happens in these people is they come about 90% back to normal with their energy levels in that first 10 to 14 days. But then that last 10% can linger for weeks or perhaps even months. And the CDC has defined long COVID as at least having 4 weeks of lingering fatigue, concentration issues, etc. In the UK, they actually define it as 3 months of symptoms. So Omicron's pretty new, but what we're seeing so far, about a month into the cases, is that there are a subset of people that will develop long COVID even from Omicron.
Well, how do you predict that? Like, is it the severity of how sick you get when you get Omicron? Does that predict if you're going to get this long fatigue or not?
$1 billion scientific question, Alex. We've been scratching our heads because initially we thought, yes, it is the inflammatory illness, the severity of the initial illness that predicts how much inflammation you're going to have afterwards. But then studies started coming out that showed that relationship to not be true. Even mild cases developed long COVID. And then on top of that, we got vaccinated, which has already made the index illness or the initial illness a lot milder. So it may not express itself. So we don't exactly know whether the index illness predicts the severity. So even those people that have mild COVID should keep their radar up and see if they're still having lingering fatigue after the infection.
Yeah, I think we've heard from friends that have said that. Now, do you have a percentage? Like how many people? Is it 10%, 20%, whatever, that get this long COVID?
This is startling, guys. It really knocked my socks off when I saw the number, because 10 to 30% of people, based on what we know about prior variants, have reported symptoms of long COVID. And now with all these people getting Omicron, assuming that it's same for Omicron, which, you know, all the other variants have had sort of the same incidence of long COVID from Alpha, Beta, you know, Delta, the original Wuhan variant. So it might be similar for Omicron. 10 to 30% of all those people in Colorado and across the country that were positive really has created essentially a chronic public health crisis with long fatigue.
So do you have, I mean, it's easy to say, you know, rest, take it easy, but like, do you have any medical advice to how we can cope with this lingering fatigue?
The most important advice is do not push yourself, because pushing through it actually may make the situation worse. And really the timeline in your head that should set off an alarm bell is 4 weeks. So, you know, 2 weeks, you're starting to get back on your feet, you're at that 90%. That last 10% should come in those next 2 weeks. And if it doesn't, it's time to talk to your doctor. Unfortunately, not a lot of therapies that we've developed for long COVID, but especially in the cardiovascular space, for example, we're starting to come up with off-label uses of other drugs that could potentially help patients cope and recover after long COVID.
That's good to know.
Okay, well, I hate to ask this bummer of a question, but can you get Omicron again?
Yes, and that is a very important question to ask right now. Yeah, it's a cold virus, right? We can get colds over and over again, but there is some silver lining here. So let's talk about this, which is that at least for the first couple of months, and a new study just came out of England that says up to 5 months, you may actually be protected from getting reinfected. But after that, there's actually data that tells us that the risk of reinfection with Omicron a second time around is about 5-fold what it was with Delta. So if you've had an infection, you're recovering, make sure you don't get, you know, a little too lackadaisical about those masks, because you don't want to get infected again, especially after those first couple of months.
That's important to hear, because I think if you, you know, I feel like I've had COVID, I'm invincible, I've got this, but
no,
clearly not.
No. That's, we're thankful. You just tell us the facts, Dr. Kohli. So all we have to do is take them in to do the right thing. So thank you.